My name is Dr. Buonassisi, and I'm a board-certified facial plastic surgeon with a practice in Vancouver, Canada. I've been specializing in cosmetic rhinoplasty for almost 20 years, and I'm here to answer your questions about this very interesting procedure. Happy patients are educated patients, and that's why every question is a good one.
How much time should I take off from school or work after having rhinoplasty? You know, it really depends on the person and what you do for work. You will have a cast on your nose, and in most cases you'll have bruising around the eyes and in the cheeks. And I think if you have to look very presentable at work, then it's unlikely that you can go to work in the first week. Now, if you're working from home and you're not being seen on camera or communicating with somebody on a computer screen, I think the following day you could certainly do some work from home, and you could definitely be doing homework. So it's not an excuse to not do your homework just because you had a rhinoplasty. Now, after a week, your cast will come off. It's much easier to camouflage your cheeks and your eyes if you don't have a cast on your nose, and so often people will go back to work the second week. It also depends on how sedentary your job is. If you're doing heavy lifting or bending over and you have a very physical job, I'd suggest that you wait a couple weeks before going back to work. But I think on average, people probably go back to work or school between 8 and 10 days after their rhinoplasty. They're probably not looking perfect at that point, but it's very acceptable in most cases. A little bit longer if you do something that's very physical. What to expect after your surgery in the recovery period. You'll go home a couple hours after your surgery, and usually you have a gauze underneath the nose to catch a little bit of blood that will come down from your nose. You'll have a cast on the bridge of your nose. It's not generally painful. There is some local anesthetic in the nose that's probably still having some effect when you go home. What I often get calls about or questions about is that the nose will start to bleed a little bit after the surgery. And that sometimes happens 4 or 5 hours after the surgery when some of the medication that we put in the nose starts to wear off. Once the bleeding starts, it just gets caught on the gauze dripper that we apply, and that stops on its own. It's very uncommon for that to be excessive or to not stop. If it's a problem or a concern for patients, then they call me and I'll see them immediately, but that's very uncommon. So let's talk about what to expect during your rhinoplasty recovery. It's very common to have questions and concerns about your recovery. We have a whole team of patient care coordinators who will talk you through it, give you all the information that you're going to need to prepare for your surgery, and they're always available if you have questions or concerns post-operatively. So after the first night, you'll still have your cast on for the remaining week, but usually bleeding has stopped by day 2. You are going to still have some secretions from your nose that you might want to catch on the gauze, but many patients will take the gauze off and just do their day-to-day activities with only the cast on the bridge of their nose. Again, it's not particularly painful. I will prescribe a pain medication, and some patients take it, but often it's not necessary. You'll be on an antibiotic to try and minimize the risk of infection post-operatively. So the first week is really just staying at home and relaxing. There's probably not a lot you're going to be doing. You could do a little bit of work as long as it's sedentary, but plan to just really have a low-key week after the surgery. So the second week, your cast comes off. That's easy. You can do that at home. Many patients come to the office and one of our staff members will do that for them. It's not painful and it just takes a couple of minutes. Once the cast is off, it's certainly a lot easier to camouflage the fact that you had a rhinoplasty. So makeup on bruised areas, you can put a little bit of makeup on the nose gently, but usually within a few days of taking the cast off, people look pretty good, and I think you could probably walk down the street and not really look like you've had any surgery done. That doesn't mean you're completely healed, but you will definitely be presentable at that point. After that, the healing process starts to decelerate. You'll see changes in your nose quite dramatically in the first few weeks, and then those changes start to slow down. But probably the nose is fully healed at about a year, and maybe changes a little bit even beyond that, but the degree of change after a year, it really has slowed down. Now, don't forget, your nose is going to continue to change as you get older, and that's not something that the rhinoplasty really prevents, but you'll just be starting with a shape that is nicer, and then as you age, of course, your skin changes, and sometimes the tip cartilages become a little softer, and so there are some natural changes that will occur regardless of whether you've had rhinoplasty.
Thanks for listening, and check back regularly for new questions and my honest answers about rhinoplasty.